My name is Ashley Rollins, and I'm a pelvic floor physical therapist here at UT Southwestern. Physical therapy can help women during their pregnancy at any stage, helping you prepare for pregnancy, during the pregnancy, helping you to prepare for delivery, and even in the postpartum period. Some of the yoga poses that we'll go through today are to be used at any time, pre and postpartum, and during pregnancy, just kind of depending on the specific needs of the patient. For child's pose, you start in the tabletop position where your wrists are underneath your shoulders and your knees are underneath your hips. And then the motion of the pose is to kind of hinge at the hips and relax your thighs back onto your calves and bring your body forward towards the ground. This is for full relaxation of all the back muscles and hip muscles. The deep squat pose is starting in the tabletop position, rock back so that your feet are flat on the floor, and move your hands back towards your knees. As you're doing that, you're going to slowly lower your hips and bottom towards the floor, towards your heels, without sinking into a sitting position, allowing for full stretching of your hips and knees. Cat-cow is a pose that's good for improving the mobility of the spine. What you do is you start in a tabletop position, and then alternating with your breath, you exhale into an arched position, looking down and curling your tailbone, and then inhaling into a more arched position, looking up towards the ceiling. Just alternate through inhalation and exhalation, mobility in your spine. Perineal bulges are an exercise performed to help you prepare for delivery. This is the practice of bulging to push your pelvic floor muscles to help encourage them to relax during the pushing process. Typically what is done is this area is the perineum, the space between the vaginal opening and the anal opening. You kind of mimic the motion as if you're trying to pass gas or to make space between the two sit bones to allow the muscles to relax while you're pushing with your abdomen. Perineal massage is another exercise that can be performed in order to help prepare your vaginal tissues for delivery. This is a gentle massaging of the tissue surrounding the vaginal opening. It can be performed about 5 weeks towards the end of gestation to help prepare these tissues for stretching during the delivery process. When you're being cared for at UT Southwestern, not only are you being cared for by some of the best obstetricians in the United States, but you have access to special patient opportunities in treatment in our pelvic floor physical therapy department. We have special training in order to provide us with the skills and knowledge needed to treat you during your pregnancy, delivery, and postpartum period. Based on our evaluation and findings, we'll create a specialized home exercise program for that person. You know, whatever your birth plan is, be it natural vaginal delivery, delivery with an epidural, or cesarean section, we can work with those goals and kind of create a plan and practice, you know, the birthing positions and things to help prepare you so that, you know, when you're there, we're creating muscle memory. So you don't even have to think about it during delivery. It's something that you practice and you prepared for leading up to it. If you're interested in any of these exercises, always first check with your physician to make sure that these are safe and okay for you to perform. And of course, reach out to physical therapy if you have any questions and would like to be seen and treated by us here. We would love to see you.